So welcome today. Today's our first podcast. My name is James Lee. I'm a plastic surgeon in Montreal, Quebec. I'm with Marie-Ève and Michelle. They're both people who help do what I do. So I'll throw it over to Marie-Ève and Michelle, and they'll do a little bit of an intro, and then we'll go from there.
Hi, my name is Marie-Ève, and I'm working for the social media contents for Dr. Lee's practice. So we had this idea to make this podcast because we know there's a lot of questions, misconceptions, and taboos around plastic surgery. So this podcast won't be about like what's the best filler, how to choose your breast implant. We wanted to explore what people usually don't hear, like the emotional side to the business side, and how social media affects the way that we see beauty. So let's dive in. And do you want to introduce yourself as well, Michelle?
So my name is Michelle. I'm Dr. Lee's practice manager, and I got dragged here. Just kidding. No, I'm here just to challenge his thoughts and, divulge more into it. So thanks for having me, guys.
You're very welcome. So let's dive with the first question. So how has the business side of surgery changed since you started? Is it more commercial now, or do you feel pressure to market yourself?
Okay, so first, I'd just like to say I've been in practice for about 10 years now, just so that it's not like I'm not just fresh out. I'm not 20 years in either. I started about 2015, 2016, and I was working mostly in the hospital, and then I kind of transitioned. Now I'm doing strictly aesthetics, strictly private practice, so cosmetic surgery. And I think it was kind of like what you'd expect it to be at the beginning, but then COVID hit, which was like 2019, 2020, and that kind of changed the game a little bit for everyone. And this is a worldwide thing. It's not just in Montreal. So because everyone was at home, they had disposable income, they had pent-up savings, and I think this is why everything kind of went up, but the field of plastic surgery went up like crazy. And what, I don't know if I could say this or not, but at one point, the implants were actually back-ordered, like breast implants, believe it or not.
Like
So
pretty much everything at that time.
Yeah, so I couldn't get certain breast implants. I couldn't get funnels for a little period, which is a tool I use to put in implant. So it was really crazy. So people who were, the whole business changed. I know the whole world changed at that time, but yes, you got to market yourself a little bit. It's a business, right? It's a medical practice at the same time, and I remember that, but it's also a business in the sense that you got to market yourself because people need to know who's out there. And I think, and Michelle, you'll back me up on this, but I genuinely think that I will do like 110% to give someone the best result. I genuinely think that they're in good hands if they see our practice. And our staff, we all believe that it's a disservice to someone to not promote that, because if we think that they have a higher chance of having a worse outcome if they go elsewhere, it's a disservice to them to not show them what they could have, the experience they could have with us, right?
Yeah.
So,
And did you see a different, like, social media-wise from the beginning, like 10 years ago to now?
yeah, so I'm older, right? So, I mean, Michelle's more of the like millennial generation.
Dr. Lee is also a millennial, a cusp millennial, but
But I'm a wise soul, like internally.
Yeah.
Anyway, so I'm an old soul. But so back in the day, like growing up for myself, I mean, you're very young as well, Marie-Ève, so you don't really know. But there was no social media growing up, and then social media kind of came in. I won't say to like reveal age, but at a certain point it kind of came in, and then Instagram came in. Then Meta took over, or Facebook then took over Instagram, and now Instagram is like a very, very big channel. Before it was just kind of posting and stuff. I know TikTok is super popular now, but I think I'm too old for the TikTok generation. But Michelle, you're still in it, I know.
I love TikTok.
But the marketing has changed a lot. Social media has changed a lot. I think Instagram is the perfect platform for plastic surgery or aesthetic surgery, because plastic surgery it's science, it's surgery, it's medicine, but it's so I don't want to sound corny and say artistic, but it's a visual field.
It's kind of.
And I talk about this to you all the time. Everyone in plastic can do a breast lift or a tummy tuck, right?
Yeah.
But not everyone's ideal of what they see and what they notice and the details and what they think is beautiful, or what they understand the patient to think is beautiful, is all the same. So I think something visual like Instagram is the perfect platform for plastic surgeons to put out their work. And I think it's so important because as a patient, someone could say, I want a natural look.
Yeah.
I like this like of breast. And they'll try to communicate it the best they can. And then someone else will say the exact same thing, but their two visions of what they like is completely different. And that's why they could come in now and say, like, for example, this.
Yeah.
And then one could be completely different than the other, because some people will say, I want a natural look. And then, they'll show someone, with very large implants, very small patient. And, the natural look is now, right? With
Yeah.
no
Yeah.
implants.
And back in the days, I think that we only had like the website,
Yeah.
and they had like only like few of before and after. But now you can see with the social media like more before and after, like daily. So I think it's better to make a good idea about the work of the surgeon.
Oh yeah, absolutely. I mean, Michelle helps me kind of because she does all the like website stuff, all the manages the people who do all the websites and all the before and after. She sees the before and afters, and we have a lot on our
Yeah.
website,
Yeah.
and we put on you put on our social media platforms when
Yep.
you can, but I think it's super important. It's like, it's like I'll use the analogy because I'm super big on analogies, but like tattoo artists. If you go see a tattoo artist, everyone's doing tattoo. They're using ink, they're using the tattoo gun, they're doing it sterile, whatever. But then, you want like realism, you want like this or that. People have different skill sets, and
Yeah.
in such a visual field, you have to see it, you have to show it, you have to showcase it, because anyone could just say, yeah, I could do it, but like show me you could do it. There's always two sides to the coin. Think about it on the positive side. I'm a glass
Yeah.
half full kind of guy, so you look at it from the positive side. You're helping people decide who they need to see. Everyone will tell you they can do a breast augmentation, because everyone can do it. Everyone could do the tummy tuck. But whose is the best is you got to see it. It's a visual field, or an industry, I should say.
Yeah.
And I think tattooing is the greatest thing. Like, they've grown a lot in popularity. They're all heavily on Instagram. You could see.
Yeah.
You don't need to be a you look at one person's tattoo art and someone else's, and you can tell who matches your aesthetic more, or what you were looking
Absolutely.
for.
And now through social media, you can like start to know like the person behind like the surgeon sometimes, and you can choose your surgeon by the person that they promote on social media.
Yeah, that kind of like aligns with your goals or the way that they're presenting themselves.
Yeah.
It's, okay, well, I can imagine myself consulting him and being open and talking about my vulnerabilities. Like, oh yeah, the doctor looks like I would feel safe to do my
Exactly.
follow-ups with. And especially with your reveals, when you go behind the scene and seeing the OR, I think it helps also take off that stress from them, because they see step by step. So like, okay, well, Dr. Lee's going to do the markings. He's going to bring me in the OR. I get to meet the anesthesiologist. And then when you do the reveals, to see how like the reaction of those patients, they can put themselves in those shoes and be like, okay, you know what? I'm ready to go meet him, and makes it more attainable.
Yeah, because
Yeah.
before that, like people were clueless. Like they
Yeah.
were taking the appointment by phone, and then like they didn't even know what was like the next step. After
Exactly. No, I think it's nice, like the way that you're promoting yourself on Instagram. It's not always like funny skits and all those things. It's really just like, okay, well, if you're gonna do not business, but if I'm gonna go forward with a surgery, even if it's just aesthetics, it is still life-changing. It's still a medical thing. It's relatable and like attainable.
That. Yeah.
I could see myself doing it, type of thing. Good job.
So let me ask you a question then, because you mentioned it a little bit. So everyone, like, our kind of social media tone is a little bit kind of where we wanted it to be, and there's a certain things we do, there's things we don't do, but there are some plastic surgeons they do like
More skits.
whatever, more skits, whatever's funny, and there are some that are hilarious. I
Yeah.
literally follow them just because I
Yeah.
think their things are hilarious. But what do you think about that? Do you think it's going too much out of the professional side and going more for just like attention and likes and stuff like that? Or maybe they're just doing it for fun just because they think
Yeah.
it's fun and silly, or they just want to show their human side, or I don't know. What do you guys think?
I've never like I wouldn't see you do that. Like it's not
Yeah.
you. So, but I personally don't agree. I think it's good for other like
other practices.
Yeah, exactly. Or like businesses. But I think like medical should stay like professional.
Ultimately, today's currency for business is attention. So if he's getting the attention and then he converts that attention, is that not a good thing that he's doing? I don't know. I personally wouldn't do it, like you said. It's
Yeah.
not me.
But it's different like if it's like conversion into followers or customer.
Yeah.
Right.
So there's like two different type of conversions that you can have through
Well,
that.
they're patients. Yeah.
Oh yeah, patient.
Yeah. So,
So
Business talk.
business talk.
Yeah.
Why is there such a big difference in pricing between surgeons or clinics?
that's a very good question.
Yeah.
And I actually talk about it with Michelle often. We bring it up, and Chelsea, who's my coordinator, which is
Yeah.
not here. But so I think, and Chelsea gets asked that question about pricing a lot. We for sure have gotten some feedback saying, "Oh, you're higher than this," or "Oh, that's good, you're lower than this." You know, we're not the lowest, we're not the highest. I mean, but we
Fairly
provide
priced.
value. We think
Yeah.
we provide good value. We provide, the best result we could possibly do, the best care we can, the most attention to detail. And ultimately, yes, it's a medical field, but it's not like you're going to buy, a Nike shoe, right? You're buying let's say a Nike running shoe. It's the exact same shoe here. It's the exact same shoe there. So you go to, the Nike store, you go to Sports Expert, and then they're the exact same price, or one's higher. You're like, oh, why would I buy it there? It's lower, right? But that's a product. That's the same product. It's identical. It's like for like. But when you're buying service and care and follow up and all that stuff, it's not going to be the same everywhere, right? Like,
Yeah.
I think you are exceptional at what you're doing with the content creation and,
Thank you so
and
much.
guidance. So, I mean, if you put, I'm not like bringing you on and all that stuff because you're the cheapest, right?
Yeah.
I'm bringing you on because I think you are the best fit for me, the best match. I think you're talented and you have the skill I want to use. So that's why you do it. Yeah.
Wait.
Yeah, I'll slip me the envelope afterwards. But so it's a service base. So it's like, and I always thought that's a bit strange. So and I'll use another analogy because I'm like that, and Michelle knows I use a lot of analogies. But let's just
I
say
love analogies.
Yeah.
you are buying art. Okay,
Yeah.
so a painter. So there are certain painters who will use the same paint, let's say an oil paint, the same canvas, the same brush, but like one guy who's super popular, let's say Alec Monopoly, will make something, and you're gonna pay, hundreds of thousands of dollars for this work of art that he's done. Whereas if someone else who, I don't know, is using the same type of stuff, a little bit different, whatever, and then he makes the same thing, same canvas, same paint, but you're not paying that much. But you're not paying for the paint, you're not paying for the canvas, you're paying for that painter's work, that painter's time,
Yeah.
right? So that's like it's a service ultimately.
Yeah.
Yes, there's cost of, for breast augmentation, implants, and all that stuff, but ultimately, if you're paying for a service, you can't have it the same everywhere, right?
Yeah.
So,
So transparent talk on what goes into the cost of surgery, materials, training, OR time.
Yeah, I think people underestimate the cost of the OR. Like, of course, Dr. Lee's not going to get into it, but it is a costly business, and there's a whole staff behind it too. All the nurses, and when they're doing general anesthesia, it's costly, and it's not to punish the patient either,
Yeah,
but it's
a
to
whole team.
Yeah, and it's their safety, ensuring that everything goes smoothly. So, yeah, I think people don't understand the cost, and it's not for any surgical coordinator to go into those details.
Yeah.
Dr. Lee will pay the price as well, but it is kind of included also for the patient.
but also you pay for high quality. Like if you
Yeah.
want better, talent, like, good anesthesiologists, nurses, talent, like equipment, you want the best of it. It's gonna be like Apple iPhones,
Yeah.
Yeah.
They're super expensive because they have one of the best cameras, one of the best screens, the best UX, UI, so
Yeah.
it comes together. So the cost has to be, translated somehow into the cost of the service or the product, right?
Yeah. Okay.
And yes, it's super expensive. Surgery is expensive. Anything medical is super expensive. Like if you bought a screen. I think the hospital told us once there's like a little like 20-inch computer monitor, which you could probably buy for like what, $100? I have no idea, but $200 or whatever. But a medical grade one, for some reason, they just put the medical stamp. It costs like 10 times as much. So all the medical stuff are super expensive. In an OR, you have at least 3 nurses, one in the PACU, one circulating, one scrub. You have an inhalothérapeute, which is a respiratory tech, an anesthesiologist, who's another specialist. You have the surgeon in there. You're running all the medication, all the drapes. Everything is one-time use, right? Of
Yeah.
course. So there's a lot of cost to it. And if everyone could have, if everyone could get plastic surgery
Yeah.
and help people, would be great. But I mean, it's a costly thing. And I'd like to get into another thing about that. I
Yeah.
think if it's a strain, for someone financially, that topic, I think I always say, like, if you're not ready for it, like from a financial situation, I think it's important to wait and not like kind of like squeeze yourself to do that.
Yeah.
Because the opportunity to do that for yourself and for your body is always there. But if you feel squeezed, it kind of like, I think psychologically it kind of hinders your healing
1,000%.
and your ability to appreciate the life-changing change that you've gone
Yeah.
through. And it's a big step for someone to do it. For me, I mean, it's hard to kind of go back to that because I just see it all the time, surgery. But I know for that one person who's never had surgery, I see them before, they're super nervous. I'm like, don't worry, it's going to be fine.
Yeah.
It's going to be okay. But it's a big commitment. It's a big step in their life. You do really want to do it once, do it right, heal well, not be stressed, So I think it's a super big cost. I understand completely. It's a big financial commitment. I think that if it's a squeeze, it's maybe not the best time to do it because you want to be in a good place, right?
Yeah.
Yeah.
And what do you think about patients who's calling to different clinics just to know the price and they choose like their surgeons by the prices only?
I think it happens for sure. I think that's
yeah,
however
I think-
people want to do their research and shop. That's completely fine. And there's someone who's going to provide the lowest price. And I think for your body though,
Yeah, I
know,
wouldn't cheap out.
you don't want to go find the cheapest person for that. I think if it's for something like
Like a minor procedure, like getting rid of a mole, maybe. Sure.
well, even that, I would tell
Yeah.
people, because it's your body, and when you heal the first time, it's really the best chance to get the best outcome. And if you don't heal right, and I've seen cases where they didn't heal right with another surgeon or whatnot, and the complication, it's so much harder to fix it because the tissues are not the same. There's scar tissue. You're trying to reverse things that were like opened or dissected, which is harder to do. And usually those cost more because it takes longer of a surgery.
So plastic surgery often comes with a lot of emotion attached. How do you manage patients' expectations, not just physically, but emotionally?
Dr. Lee's really good with that.
Am I? I don't.
Yeah.
Well, I try my best to. You said their physical expectation. How did you-
Emotional.
Yeah, just not physically, but emotional as well.
Okay, so I'll do the physical. It's a little bit
Yeah.
easier. So we really, and the whole team, we all have the same kind of philosophy in the practices. We really are not there to convince someone to have surgery. Okay,
Yeah.
we're like completely not there to convince them. The decision has to come from them, even if they'll say like, should I do it or not? I get that question a lot, and I'll always answer the same thing. If it bothers you enough to do surgery, then I'll tell you if I can help you or not. But I can't tell you if it bothers you. If you just thought about it once today and it was the first time you think about it, it's probably not enough to bother you. But if it's something you've been thinking about, for like 5-10 years, it's always bothered you, and you're just like, it changes things you do. Like, for example, I do a lot of gynecomastia. So if someone doesn't feel comfortable wearing just a t-shirt just because you see the gynecomastia, or someone who has after pregnancy, like the fat and the skin in the abdominal area that they can't get rid of, and they have now been able to wear some of the dresses they love to wear, and they've been thinking about it, and they always kind of try to hide it, and then it's worth it to do surgery, right? So that's the first thing I'll say. And just to tie it back to what you said about social media and before and afters, the physical expectations or the realistic expectations of what they expect, we pride ourselves on being super honest, super genuine. If I cannot do something, I will tell them it's not possible,
Yeah.
right? And I know from what I've seen, I try to explain as much as possible or the best I can. But it's sometimes more difficult to communicate those points because for me, it's very clear that there are certain things because it's a science. It's not like, and I use this in the consult sometimes, I say, it's not like Photoshop. Like if, for example, and I'll use breast for an example,
Yeah.
okay? Just because we do a lot of breast. So if the chest wall, if I've lost you, then just tell me and then I know that what I say to patients is not right. So if, for example, the chest wall, like the ribs and the sternum are very curved, the breasts that sit on the chest point a little bit more outwards, right? But that's because the base of it, right?
Yeah.
Where it's sitting is on a curved rib cage and chest. So they point more outwards. So sometimes I'll see a patient who comes in and say, you know, I like this picture and her chest is very flat, so her breasts point forward. And she's like, I like it like that. But, and then I'll frankly tell her, I'm, you know, because of your anatomy, I can't change your rib structure, change the direction of your breasts. You know, there are certain things I can do, but that's something I can't do. Another thing is when people say the breast is here, right? Not falling breast, like where it connects to the chest. I call it the breast footprint, and maybe I'm getting too scientific here, which is not the point. But then they say I wanted it here, right? But that patient has a low-lying breast, like not that the breast fell, but the breast itself. If there was no gravity and just like floating, and it's connected here, I can't detach the whole breast and re-stick it up here and then do a breast augmentation. Do
Yeah.
you know what I mean?
Totally.
Yeah, and we use something called, it's like a 3D camera. I won't say the name in case for whatever branding you can't do it, but it's a 3D camera, and I think it's been super useful. It doesn't help me plan because I already kind of have my measurements and I know
Yeah.
what I want to do, but it helps explain. And I think for an educational tool, it's super good. And there have been patients who've seen this simulation, and I'll tell them what I think is realistic from the simulation
Yeah.
and what's not, and what are the limitations of their anatomy. And if they don't like the Vectra and they decide not to have surgery, I think it's a blessing because they would have gone through this whole recovery, the financial commitment of doing a surgery, and then they wouldn't have been happy with the results. So I think it's a great tool to really get people and to understand what's realistic, what's not, and educate patients.
Totally. Because I did it. Like we tried on myself, and I really liked it.
Yeah.
Like, it's more visual for the patient.
Exactly. Yeah. So I think it's I think it's a surgeon's duty to properly guide them to their what's realistic, what's capable, what's possible, what's possible and what's not. And if there are limitations, I think it's like super important as a physician, like from an integrity point of view, tell them, I cannot do this because it's not possible, right?
Yeah.
And I'll actually, you know,
Yeah, as you should.
tell some patients, like I think you've been with me sometimes, or I told the patient, like if someone tells you they can do this, like just be weary. You know, I don't think it could be done. If you don't choose me as your surgeon, that's completely fine. But just be educated on what you're doing, you know?
Yeah.
So we're super like that. I hope everyone's like that. I'm sure everyone in the professional field does
We hope
educate
so.
someone. Emotional.
Yeah.
So
on the emotional
we
part.
actually have a sheet, and we're super. I mean, Michelle handles that pathway also, so she knows. But when someone has surgery, we're super close. We do super close follow up at the beginning because the initial time is like they don't know what's going on. Like we've seen it, you know, thousands of times, but
Yeah.
for them it's new. We understand that, so we go through very step by step. We try not to overwhelm with information because that could become overwhelming. We know that the first week or two, you go through that kind of like euphoric phase where you're like, this is the best thing I've ever done in my life. But then we also know that, you know, as things go up, things go down, and we call it like an emotional roller coaster post-op, and we
Yeah.
see it. It's a classic thing, you know, where
Okay.
you,
And it's both men and women,
Oh,
all
really?
ages that go through it.
yeah.
And is it like mostly all the same type of surgery, or it can be like
All of
different?
them. It can be a man from gynecomastia, it can be someone from an optimization of a scar, tummy tucks, everything.
Oh, really?
Yeah.
Yeah.
Okay.
Yeah. I think it's, people go through it with different like intensities.
Yeah.
But I think we educate them on it beforehand. So if you're going through that, like have just ask someone and call us or whatever, and we'll just guide you. And we try to keep the follow-ups close at the beginning, and we tell them kind of what you're gonna expect, right?
Yep.
Because the healing is not just like you do the surgery, you're done. There's healing periods where you will be. Initially, you didn't swell. You like, this is the best thing I've ever done. Then it swells. You're like, what's going on? The fat's coming back, but or then it goes down and the skin gets a little bit looser and but a little tight. So there are phases, and we try to guide them, and that's an important aspect of plastic surgery, right?
Yeah.
And care and the plastic surgery experience, because we think the experience should be exceptional for everyone.
It's part of the whole process.
Exactly.
Yeah.
Going back to the overseas thing, right? Mm-hmm. If you don't have that follow-up, and let's say you're having you're really something's going wrong, you're like stressed, you're worried, no one to call, I don't know what you'll do. I mean,
True. Have you ever had to refuse a patient because you felt their motivation wasn't healthy? How do you handle that if it was the case, if it happened?
well, we try to. I can't think of an example where we think the motivation was not right, but I do know we kind of ask, we try to have the questions, how long have you been thinking about it? Those kind of
Okay.
soft pre-screening. If we have any worry, for sure, we're gonna try to say we may not think you're ready. People don't like to hear that, obviously, especially if they're determined. They're like, I really wanted Dr. Lee to do.
Yeah.
We're like, we don't think you're ready or you're in. We do the consult completely alone with the patient. We don't. A lot of times we get some pushback, right? And because they want their conjoint there, which afterwards they could come for the question and answer stuff. But for the actual medical exam, determining what their goals are, we really want just the patient. We don't want anyone there.
To
Even
influence.
if someone's mom wants to be there.
Oh,
someone's-
really? For the first one? For the first
Yeah,
consultation?
someone's conjoint or boyfriend, girlfriend, whatever. We really don't want an influence on that. Same as implant size, even that's what we see a lot too.
With
So,
the husband or?
yeah, the husband may kind of want something else, but
Oh, really?
we want. That's why we do the consultation. We may not be, it may be the exception more than the rule that
Yeah.
most people don't do that, but we really want to be just with the patient, get the medical history examined, really get the goals, and I push for that hard in my practices. When someone tells me, oh, the patient's here for breast augmentation, I'll say, I said, no, what does she want? Not the surgery. She wants to feel better about this. She's lost it. I want to understand what her goals are.
Do you remember your first 6 hours surgery? Did you felt exhausted after that? How do you feel through the 6 hour surgery? Because I think it was one of the first time that I filmed one.
Oh, yeah?
It was.
Well, in the hospital, there are people, I don't do it, but I mean, there are people, and a good friend of mine, I'm going to tell him I spoke about him and he'll be happy, but he does big cancer surgery, and then plastic surgery joins him to do the reconstruction. These are big surgeries. Sometimes they take 24, 36 hours. When I was a resident, I had a staff, it was Dr. I don't know if I should say the name or whatever, anyway. But we did a recon case, and I remember it took 24. It wasn't going well. I think it went on to maybe 30 hours. These are long cases. So the 6 hour case I'm doing, yeah, it's long. It's not that long though. As you know, every step I'm constantly doing something. The time passes very quickly. For sure, it's very physical. I mean,
Yeah.
Michelle has observed OR too, so it's super physical because you're standing in the same spot. So you're not walking, pacing around a room for 6 hours versus
Yeah.
standing in the same spot for 6 hours. It's much more tiring to stand in the same spot. You're mentally and physically drained after a long day for sure, and I think any surgeon could attest to that. It
Yeah.
is physical. Depending on what you're doing, it
Yeah.
could be more. Those longer cases that the people do in the hospital, hats off to them. It's real long, and to do that week after week, it's tough. But I see the surgery as my game day.
Oh, yeah.
Yeah, we
Yeah.
can't bother him.
Yeah, I need to be in the zone. I need to
Totally,
have slept
totally.
well, come in.
Yeah.
I still, even today, after 10 years of practice, I still review the cases a day or two before, just to make sure everything I want there is there. that's just like an OCD thing, no more than like
Yeah.
It's a careful step, though. I think it's a nice like a
Yeah.
trait. Yeah.
like I'll look at the photos, I'll review them, and I'll be like, okay, this is what I want to do. If there's something specific I wanted to do during the consult, I'm with Christine, the nurse, and I'll tell her, write that down, like more on the right or left, something that I don't want to forget.
Yeah.
And then when I review the case, I'll highlight that out so I remember that
Oh
there's
my
certain
God,
stuff.
that's good. I didn't know that.
Yeah, I'm super on jealousy. I'm like, I need my list, and this will be a week before. I want to just know if the photos are not like the pre-op photos
Yeah.
are not good, like someone's hearing about it because
Me.
yeah, I like who took these photos. No, it just has to be on point.
What has working so closely with people's insecurities taught you about human nature?
That's a deep question, Mariev.
I'm pretty good for that.
Yeah. I'll let Michelle take that one.
He's throwing the ball at you.
No. Sorry. No, Dr. Lee can answer that. He's really good.
Okay, so you're gonna have to repeat that one more time, and I'm gonna think about it. I'm gonna pause for a little bit.
What has working so closely with people's insecurities taught you about human nature?
So just to like clarify, I don't like to think about it as people's insecurities.
Yeah.
I like to think about it as helping them go where they want to go, that exercise, diet, all that stuff cannot take them.
Yeah.
So I don't think about it as their insecurity. I think about helping them get to where they want to go, and trying to make people happy
Yeah.
rather than fix insecurities. I just look at it that way. I try to make people happy. That's why when we do the first post-op, like 2 days later, 1 week later, when I can, if I'm not in surgery or whatnot, I like to pop in and see them because that time, the best. Okay, like we just did one yesterday. You were there Monday.
Yeah, it was amazing.
Super nice patient.
Yeah.
You know, really put the trust in us to do like the big surgery, the big mummy makeover, and like when you see how happy they are and like it's good. It's
Yeah.
worth it. You know, everything you do, all the hours, all the things, it's worth it. It's good. I think people who are very critical of themselves before will be critical of themselves after, no
Yeah.
matter what. I think people who look at where they want to go only, it's difficult to be happy. People who look at where they've come and how far they've grown, they're going to be happy. Does
Yeah.
that make sense?
Yeah, totally.
Yeah.
I love your answer, and really, like, I truly love the answer that you just gave, and that makes me very proud of working with you.
Right?
Thanks, Aiju.
Yeah, really.
Yeah,
I really do.
I agree.
Let's dive into the beauty standards, social media, and the digital world. Break down common misconceptions patients have based on social media. How does it impact, like, the patients towards your job? Do sometimes they comes with like photos that they see and they want to have the same thing?
Yeah, for sure. People come in with photos, and it's super helpful actually because it gives me an idea. Because someone could say I want this, but then what they show is like completely different. So it's super helpful. It's really helpful when they have actual photos of before and afters that they found, because sometimes
Yeah.
they'll come in with like oh, I like this celebrity's look, and then she's wearing like a bra, and then she's like that or whatever. Okay.
Like the angle.
You can't see anything
Yeah.
in a push-up, not push-up. I mean, you guys know better than me, but I mean, push-up or not push-up, it could change the look completely. Swimsuit or a shirt, or like you can't really tell. So
Yeah.
if they're in like that before and after like medical pose, then you could really tell. So they come in with that, but it gives me an idea. I do like that, and it gives an idea that what can be achieved and what can't be achieved. Because I'll try to dig a bit deeper. Like, what do you like about that? Is it this? And they say, I don't want that. I like that. So it helps a lot to really gear if we can achieve what they want to get, and educate when there are certain things that can.
And do you see like some type of trends towards like body's image and like beauty standard that changed through social media?
Within your practice, though.
Oh, within my well, just but I think like now I think it's less. I see less posts of it, but before there was a period, maybe during COVID, where kind of like that extreme
Yeah.
kind of result was super in, and people were posting extreme results where, like intense liposuction around the trunk area, and then intense like high volume fat grafting to the hips and buttocks. So really like a super, almost like hyper curvy type of result. And then like someone is posting like, they're like a selfie like that where you see like that one angle. So I think that was very, very present. I mean, correct me if I'm wrong, if it's less so now.
Yeah, it is now. I think
I'm
it's
fine.
it's going like more on natural. Do you believe social media has had more of a positive or negative impact on the industry?
I think that like overly extreme stuff, I think it's hard because when the over extreme stuff becomes trendy and in, it's very hard to reverse the overly done, even if it's something as simple as like overly injected lips,
Yeah.
or over injected face or overly done, lipo or whatever, or, those things, you can't reverse it. That's what people don't understand. If you do too aggressive liposuction, maybe at that moment you're like, this is great because you're down, but then, a little bit of weight fluctuation and everywhere gains except for there, then it starts to look a little bit abnormal. Then you realize you could see some irregularities. Then, and I've seen cases where young women, like very, like, pretty beautiful women who have gone kind of extreme, and then, now like they're literally like more shy of their like abdomen or trunk or whatever because it's down the line. It didn't age gracefully, if that makes sense.
Yeah.
So I don't think anything in life in general should be too extreme,
Yeah.
including plastic surgery, including injections, including whatever. I think the trends, and again, I'll bring it back to tattoo analogy. There were trends in tattoos too, right? So I think natural beauty will always, or a natural look, is always going to win long term, nothing extreme. Breast implant sizes too, there are definitely trends in that. At some point, very big implants were
Yeah.
super in.
And now it's like
more like-
almost.
Like itty bitty
Yeah.
committee,
Yeah.
It almost goes with celebrities too, don't you think?
Yeah. Absolutely.
Yeah. So I think it's tough because when you put implants, for example, if you put large implants, the skin has been stretched to a certain point. So you can't, it's harder to just go smaller. Whereas if you went, moderate and you want to go a bit bigger, that's a lot easier for your tissues and your body than to do big and then go small, because there's a lot of repercussions. It's like an elastic that's stretched out till here for like years, and you let it go. It's not going to bounce back. Whereas if it's like this, it's not bad, and you stretch it a little bit more.
Yeah.
That's my elastic analogy, okay?
What's the most underrated procedure you offer? Like one that deserves more attention?
Well, I only do 4 things now, right? So I do breast augmentation,
Yeah.
breast lift, liposuction, tummy tuck, gynecomastia,
Yeah.
right? And
And those things can be combined.
those could be combined, yeah.
Yeah.
So the mommy makeover is just something tummy with breast, or the daddy do-over we call, which is not just for dads. It's like
Yeah.
abdomen and gynecomastia or chest.
Do you think gynecomastia is one like underrated?
Yeah.
I think that would be
I-
like the one.
Talk about it all the time to all my friends.
I think it's under promoted.
Yeah.
It's under promoted because you've been observing me in the OR, like it's huge changes.
Yeah.
You've seen the patients, they're super happy.
Yeah, it's insane.
And it's like instant, like as soon as we take out that gland and I've kind of done a bit of lipo and remove
It's
the gland,
crazy.
it's like a big difference because some cases are more mild than others, and people who will say, oh, it's what's the point, you could, but the person who comes in for consultation, they're really bothered by it. It's not to belittle their thing. You can't belittle. They're genuinely bothered by it, and it's they'll train. It's nothing to do with that, and I think it's such a satisfying surgery in the sense that they're satisfied. I'm satisfied to remove the gland for them, and it's under promoted because, and I always say this joke or story, but let's say someone your neighbor gets a breast augmentation, okay? Like,
Analogy.
yeah. No, it's not an analogy. It's not an analogy. So let's say, I say, as joking, your voisin gets a breast augmentation, she's showing like the whole neighborhood, like check it out, you know, like I got it. She's wearing a bikini top, she's super proud, you
Yeah.
know. But the guy who, let's say, comes and gets daddy do-over or gynecomastia, he's not going to tell all his buddies, guys, like check it out, you know, like
Yeah.
you know. So that's why I think it's under promoted, but it is quite common. I think I do probably like
You
the
do a
most that
lot.
yeah, I do a lot. I do a lot.
Yeah.
Yeah.
All ages also.
But can you just explain a little bit more about the gynecomastia? Because I think there's a lot of people who doesn't know what it is.
You don't understand what it is, yeah.
Okay, so it's the male chest. Okay, so there are certain people that have gland development behind the nipple areola complex. Okay, nipple area, and that's probably during puberty or hormonal. Okay, hormonal is usually you see it. You know, super lean guys, they take anabolic steroids, so the big shoot of testosterone. Some of it gets converted by estrogen. Then you have a
Okay.
bit of gland development. So it's gland. So it's not fat. It's very hard. You've seen it come
Yeah.
out in the OR. It's like a hard rubbery mass. It's usually behind the areola, and then it kind of gives that more like. If Christine was here, she would know what I say. So instead of like, if you're super lean, instead of the pecs looking more like a V, you kind of have that upside down V, you know, just because it's hiding like the lower area. So it really bothers them, like in shirts, even clothing, polos, like white, more light colored shirts. They come in saying like, you know, they just don't like it. You know, they're training. They don't know if they should do more pecs, more cardio, less cardio, whatever. There's a bit of fat around it, but it's the gland itself. And that gland has developed mostly physiologic, which means just part of normal development. There's nothing wrong with it. But if it bothers you, I think it's like super satisfying for that patient to
Totally.
get rid of it. It's never going to come back unless they take certain medications that could be associated with it. And then just like not have to worry about, you know, wearing light tees or whatever it is, right?
Yeah.
I do a lot. I don't know how many cases other people do, but I definitely have been told by many people, like you do a lot of cases of gynecomastia. And we do all ages, right?
I think for real, it's like one of the most surgery that I filmed.
Really?
With you, yeah. I filmed a lot of gynecomastia.
More than tummy tuck?
I feel like ever since I started with you guys, it's a lot of the ones that accepted, like that consented to being filmed, a lot of them were gynecomastias.
Yeah.
Yeah.
I did, yeah, we did some tummy tuck, but like for
Yeah.
a while, I think for like
was a
a
day that
month
was
or
only
two,
that.
like it was only
Yeah.
gynecomastia.
Yeah. There was a period I remember
Yeah.
where like there were tons of like, we
Yeah,
did,
it
like,
was like
10 guys just wanted all, and then they all said okay to film.
Yeah.
Because it's rare that they'll film. So what people think is like, maybe 1 out of 10 will say okay
Yeah.
to film, right?
yeah.
What would you say, 1 out of 10-ish?
In general or for gynecomastia?
Just in general, 1 out of 10, 10%?
I don't know. There was like a spur recently. Like I feel like I was always texting you like, "Hey, are you free this day? Are you free this day?"
Yeah, they go in waves, I'd say.
Yeah.
But overall, I would say 10% are okay to share.
Yeah.
And then it just hit or miss which procedures they end up being.
And we appreciate that so much.
Yeah. I wish we could promote it more because honestly, it is so life changing, and a lot of your patients, they're extremely fit. They have abs.
know.
They're like.
And there's a
And-
lot of misconception about that.
Yeah, and like they're anticipating like when can I go back to working out? When can I go jogging? And we're like, take it easy because like we want you to heal properly. But when people are like, oh, well, he could just go to the gym, he could just work out his chest. Like, no, the chest is the problem. His muscle is there for sure, but
Yeah.
it's the gland that's in the way, and they're self-conscious. Like, no, the fact that you're getting a lot of patients, men of all ages. I think it's a nice that you're creating that safe space for them and that you're creating more content about it
Yeah.
so that they can understand what it is.
But he's really good with the breast
Yeah.
sizes. I'm like very impressed. And I think most of your patients give you like the choice for them. Like you choose for them the size, right?
Well, they trust me to guide them, but I base that on, like, when I first meet them, or you're talking about breast implant, right?
Yeah.
Yeah. So when I first meet them in consultation, I really, like, I'll ask them, what do you want to do? Like, what do you want to be? Like, what do you like, you know?
Yeah.
And then from there, I'll tell them, because if you come in and to have you choose which profile, right?
Yeah.
Like moderate class, which profile, like this one or that
If
one.
it projects more, if it's
it
higher.
projects, you can't know, right? You
No.
could, but you can show me what kind of stuff you like. So I'll remember that, because during the process you'll flip flop, you know. And I always try to go back to my original note. I always write down like, what is the goal? You know, and
Yeah.
we talk about it. I'm super stressed on that because during the process you'll flip flop, and it's normal to change your mind, right? So I try to go back to that goal, and I'll guide you to what it is. The profile, though, how much it kind of goes forward, I'll never ultimately choose that for you. I've heard some stories where they go in, oh, you're going to get this CC, it's good, you know, and they're like, okay, and then just kind of do it. But I'll never choose that for someone. I'll always have them choose it. But what I will choose the final is maybe a little bit of the size.
Yeah.
But the size of it, people think it's the CC, it's going to make such a difference. But when I say the size, I'm literally changing the diameter
Yeah.
by like 2-3 millimeters. And you know, you've seen me put sizers, which
Absolutely.
are like, you know, you could say, I'll do another analogy. So, okay, so you could use this for your thing. So if you look at a shoe online, right, and you're like, I like this shoe. Sorry, I'm going to change that. No, I'm going to finish the shoe and then I'll give you another one, okay?
2 in 1.
So you, yeah, you get 2 today. So you look at a shoe and you're like buying it online. And usually for Nike, you're wearing whatever, I don't know, you know, women's 7, okay? And then you see this shoe and it's a super nice shoe and it's like whatever. And you're like, I like this shoe, I want it. You usually buy 7 women, so you're gonna buy 7. The European size, it's a special shoe, women's 7 equivalent. You order it, it comes, you put it on. For some reason, it doesn't fit right.
Yeah.
Right? It's just a little bit too big. So in this case, you would have liked to have the 6.5 instead of the 7. But how could you have known that if you didn't try it, right? But I know you like that shoe. So I know you like that profile. So I have that in hand. I'm not going to just change the color of the shoe. I'm not going to be like, oh, she doesn't like the heel this big. I'm not going to change that, right? But I'll tweak it so that it fits your shoe, for your foot perfectly. And that's how I determine the width.
Yeah.
And that's 2 or 3 millimeters, which changes the number of cc's, right? So
yeah.
people are so fixated on the cc's, but I try to educate the patient. And let's say you were like, but I really wanted a size 7, Dr. Lee, right? But I told you, you wanted a shoe that looks like this, that fits you well. For you, it ends up being 6.5, you know?
Yeah.
So that's how I think about it as a thing. I literally just invented that now, but I think that's a good one that I'm going to use.
But I like
during
the dress
consult.
one that you said in the past.
Oh, yeah. So the dress one, let's say you see a dress. It's the same principle. It's like online shopping. You see a dress and you show me that dress and you're like, this celebrity was wearing this dress. I like it. She is wearing a large, right? But you like that dress and you like how she looks in it and how it fits her. Let's say it's snug here, but not too snug, right? You like that
Yeah.
fit. And you like the dress, you like the color, you like the style, whatever, and you like how it looks on her. But I'm not going to say, you're going to come to me and I want this dress in large. But for you, it might look super frumpy on large. Do you still want the exact same size that
Yeah.
your friend or your neighbor has? No, you want that look, but on you, which might be a very different implant. So that's equivalent to someone comes in and says, oh, my friend got 300 cc's. It looks awesome. I want 300. You don't want that 300. You want that look.
Yeah.
But for your dimensions and proportions, you might need to be fitted with a size small of that same dress, though. The dress being the profile.
Yeah. To be honest, I saw like a lot of before and after on the table for the breast augmentation, and you're always on point. So even if he's a man, he has the vision of the natural look and the proportion.
Yeah.
So like, I was just saying
going
that.
back to Michelle's comment to debunk that.
But that's what I was doing because, like, I know what she's saying about,
Yeah.
like, the men feel confident with a male surgeon. But I felt like I had a consultation with Dr. Lee, and I felt, like, very, like, understood. And even if he's a man, I saw, like, what he's doing, and for his proportion is, like, on point all the time.
I honestly, like, it's no shade to him. It's just like me, like an internal thing. Like,
Yeah.
Right.
I think I would feel comfortable if Dr. Lee had, well, I know he has a sister, but let's say if he had a twin sister that's a female that has the same thing as Lee, like the same traits, same expertise, same skills as Dr. Lee, but as a female, I would do it. But I think it's just like a personal thing. Like, I would still want it.
But
with a
let me
woman.
ask you a question which will challenge what you're saying a little bit, okay? So that would be applicable if I was putting my ideals towards you,
Yeah.
right?
Yeah.
But what you have to understand is, what I am is just like a technician, right?
Yeah.
Like I'm a technician with high attention to detail with like doing surgery. So I'm not deciding what you
No,
do.
and you've never
I'm
decided
matching
it.
that
Yeah.
goal. So it shouldn't matter if the person is a female that knows the anatomy. Same as a female surgeon who could do gynecomastia,
Yeah.
same as me or better. So they're not understand if you're going with the fact that just do what you think is right, then fine, I understand that, right?
Yeah.
But if you're telling me and I'm going as close as I can to what you want, then it shouldn't matter male or female.
Exactly.
I
You
agree.
like that
Yeah.
one, eh?
I like that one.
But there's still a part of me that is so extremely shy.
Yes, that I understand. That
And
I
so-
completely understand.
Yeah.
That I completely understand.
I would never want Dr. Lee to ever see me.
But
in
you know
a
that part,
pre-op
that was
version
one
as-
part of that I was hesitating because I know everybody in the OR as well. Like I'm
Exactly.
working with them. But on the other hand, I was like, I know the OR. I know the place. I
Yeah.
know all the team. I like trust them, everyone. I trust him. I know how he works.
Mm-hmm.
I know like his stitches and like everything. I know the before and after. So
1,000%. Like I trust the whole team and where he works at, and 100%. It's just I think the way I see Dr. Lee, I just cannot let him see me in a pre-op. Like
Yeah. But
no.
No,
when
for
I
sure
arrived, I was like it was a little bit weird, but
Yes.
he shifted into that professional mode.
1,000%.
That it changed everything, and even like myself, I felt like I didn't even know him. So it shifted, and I felt so comfortable, and thank you for that.
Very nicely.
Yeah.
Yes, I am very professional, I must say.
Yeah, he is. He is.
I understand what you're saying about that because for sure when we see patients, I know, some are more comfortable than others, but, ultimately after I see them, that I've talked to them for like 5-10 minutes.
Yeah.
I need to examine them. And it's something that they might be shy about. And, for sure, if you're like, a female, another female to a female or a male to a male, you feel more comfortable probably in some cases. Or, if someone is around the same age, for sure, it's a bit tougher,
Yeah.
I think,
Yeah.
right? When you're doing like, breast surgery or tummy surgery,
Yeah.
you're just like, the only thing that is exposed is what you need to work on,
Yeah.
right? So it's like, and as a surgeon, I could say like, you're in the zone, you're not like
Totally.
thinking,
No, I agree.
You-
And he won't remember because I filmed him 2 days ago for a mommy makeover, and that's what I'm going to do with Dr. Lee. And I was like, "Oh, does her tummy look like mine?" And he was like, "I don't remember your tummy."
yeah.
So
yeah, because I mean, I've seen so many tummies then, and when I'm, like you said, when I'm in the zone, I'm
Yeah.
thinking what I gotta do. Like this gotta be what I gotta watch out for, what we can do, what we can't do. I'm not like, hey, not yet, right?
wait, but yeah, what's going
Don't forget, it's like my like trade,
Yeah.
You did like 10 years of like intense studying and technical drilling to do what I do,
Yeah.
So it's not like,
And how is it when you come back home? Do you like shift as like a father like mode, or
He's so
sometimes
excited
you
to see his
still,
kids.
or you're still sometimes at work in your head, or you just like you can shut
well,
it down?
for sure, work follows me home in the
Yeah.
sense that, like, I'm super into like family and like and like close friends and all that
Yeah.
kind of stuff. But for sure, the work follows me home because if someone's not doing well for some reason, which is rare, thank goodness, I'll knock on wood, right? But when it does, it really like it's on my mind. Like my wife knows too.
Yeah.
When someone didn't do well, someone had a complication, it worries me maybe just as much as the patient itself. And then I'll wait till the morning till it's a decent time before messaging the team. But I'll be like, I thought of this last night. Bring this person in. I want to just make sure this is okay.
Yeah. 2 days ago when I filmed you for this 6-hour surgery, and I looked at you and I was wondering, like sometimes people think their jobs is like doing all the time the same thing, like it's repetitive. Do you feel sometimes like that in like surgery day? Like,
No, because every case is a little bit different. For sure, as I subspecial, I mean, already I'm just doing 4 things. It's pretty specialized.
Yeah.
But I think and I was talking to Michelle about this recently. I said, I think if we were in a position, if I was working with because before I was, I did electrical engineering, right? So I was an engineer. So
I didn't know that.
you knew that, Matt.
His diploma's
You knew
in
that.
in his office. It's like one of the first ones.
Really?
Yeah,
Yeah.
I did génie électrique before medicine.
I didn't know that.
You knew it. You just forgot.
Okay, I forgot.
Anyway, either way. So if I was that, and let's say I was coding at like a desk or whatever, I mean, it wouldn't be for me. It wouldn't have been for me, I think. I like the hustle bustle. I like I like things changing. I like to continuously improve stuff. Some people don't like that, but I think it was good. I think, as I was talking with Michelle about it, actually, like every day, yes, some days we have clinic days, some days we have, but it's always different because we're meeting so many different people,
Yeah.
so many different cases. Even though someone is doing something, just it's still different. Like it doesn't feel repetitive.
Okay.
No.
That's good.
So I thought of a question that I'll ask you.
Yeah.
And Michelle could take it too, but
No.
I feel like she's skewed because she's like working deep within the practice. But
Yeah.
when you as a woman or potential patient, what do you look for when you're doing your research for a plastic surgeon, and what would drive you towards someone versus not? Like what's a red flag, what's a green, a pass, what's like a golden ticket,
To be honest, because before I knew you, like I've been searching for now 13 years to have this mommy makeover. And the first thing is the personality.
Really?
Yeah, that comes through social media. Just like that makes me feel like more comfortable with the surgeon. And after it would be like the before and after, several before and after, like to just make sure about the style of the surgeon. Like if it fits with what I want. But the first thing is the personality.
Really? So what if the personality is great and you're like, this is a great fit, I really like this person, but then the before and afters are so-so? And to look
I
at-
won't take him for sure. It has to have the two.
Oh, it has to be the two.
Yeah, of course. But like his personality is gonna like have my first.
It's the first filter and then it goes
Exactly.
on to the before and
Yeah.
afters. What if the before and afters are so exceptional where like it's the best,
Yeah.
right? But
But
then he's like a big A.
I don't know because I think you have to trust him and like you have to be comfortable to talk to the surgeon and feel like
The message is being delivered. The
exactly
vision is
and
there.
you feel understand and
Yeah.
like safe with that person.
I agree.
So for me, like it has to have both.
What about the online reputation? Important or not? I know for the millennial generation,
Yeah.
it's important-ish.
I think it depends what the comments are. So let's say like a lot of it is like let's say 90% of it's nice comments, and then the bad comments. Sometimes like it's worth reading what they are, and sometimes it's like, oh well, the receptionist just doesn't answer the phone, or this particular nurse. If it's just let's say the front facing, or it's just like this one isolated event, that's not going to skew, in my personal opinion, like it's not going to skew my opinion if I wanted to reach out to him.
Yeah,
But
no,
if in the
yeah.
comment it's like, oh, all of my follow-ups were amazing. He was amazing in his during surgery and after, blah blah blah. But it was just that his nurse, I just didn't really like her. But
Yeah.
that if it was just those things, but if it's about the doctor, they're like, oh, he was cold, he was dismissive, he treated me like this, then. If
Okay.
that's the common
Yeah.
occurrence, I wouldn't want to go see that doctor.
But you know what's funny is that I had a breast augmentation 11 years ago, and I won't say his name, but a lot of comments was like he is harsh, but he's good, but he's harsh.
Yeah.
So I chose him otherwise because I liked his
His
before
work.
and after, And I went there, and he was harsh, but I knew that, so I was okay with that. But like, he was nice too. He understood me. But
So that kind of goes against what you said before.
yeah,
then.
but I think that's why, because now I'm thinking that way.
So I don't think people understand that. Yes, it's a business. Like private practice is a business, but it's also still a medical practice, right?
Absolutely.
And the medical practice is like, you know, obviously it's a team. I can't do anything out without my like A team, but it ultimately falls on me. So people think like, you know, if you go to the Walmart site or Google Business and you're like, oh, you know, the greeting person was rude, you know?
Yeah.
And then you put a bad 1 star, right? I don't think Walmart cares at all, right?
Yeah.
Like, I don't think they care at all. They're not caring about that. But if I have someone who, you know, felt like not good, or like we like, you know, they claim that they felt rude, they felt that it was rude or whatever, I take that to heart, you know, and like really, like it bothers me that we made someone feel like that.
Yeah.
And
You
I
take
think-
it really personally.
Yeah.
I take it personally, but not to be like necessarily upset at that person, but upset at the situation,
Yeah.
because, you know, I take those things to heart. And, you know, like we're not a Walmart, like we're people trying to make people happy. And then, you know, someone puts a negative comment, it sucks, right?
Yeah.
1,000%.
So I think when it's about like something that's not the medical core itself, it's really sucky, because, you know, there's, let's say, 100 and something patients who went through the whole surgery, the recovery, you know, the healing, the follow-ups, and they're like, this was a great experience. And then the one person who had a bad first phone call has, like, if not more negativity and effect on that practice
Yeah.
than the person who went through a year of follow-up and whatever and was super happy, right?
Yeah.
Because that 1 or 5. So that's one of the things, like, if you think about business, you know, the reviews are super helpful, but I think sometimes, you know, it could not be just at the
Yeah.
same time. Okay, so Michelle, I have a question for you then, just to keep it a little bit more light and fun. You've been working in the industry for a while, right? Well, even before, you were kind of more in like the beauty-ish,
Yeah.
right, industry or whatever. So what do you like most about working in the industry? And as a follow-up question, what did you not know about the field of plastic surgery before you started working? Because now you're like deep in it, you know what the ins and outs are.
So my favorite part, and I think I've told this to everyone, is being part of the journey of the patients. So seeing them from when they came into the consult, how they carried themselves, like they were super shy and whatnot, and then being able to answer their questions in between, seeing them during post-op and how their demeanor changes. I think that's my favorite part of it all, and seeing how they talk highly of their experience, the surgery, and of the team, and how so happy they are. I love being part of that, especially when it's like people you don't expect. And I think there is a stigma around plastic surgery. You think that it's the person that's done up, that has a lot of money, that lives in a luxurious lifestyle, but it could be someone that works at the DEP, the person
I know.
that's,
Yeah, I noticed that.
you know, walking across the street with their dog. It's anyone and everyone. So just to see that there's no discrimination with plastic surgery, I love being part of that. And what I didn't know about plastic,
Well, just to continue with what you
Yeah.
just said, do you think, and actually, Marie-Ève, you could also answer that because you've worked with other plastic surgeons previously, is, you know, the things you're saying about what you like about it and what you kind of debunked about it, do you think that's consistent throughout the field of plastic surgery, or do you think it has to do like practice specific, you know?
definitely practice specific. But I think I was told this before, and I actually believe it. Plastic surgeons, or maybe surgeons in general, they attract like how you are as a surgeon, how you are as a person, you attract that same type of personality to your.
Totally agree. Yeah.
Really?
Yeah.
Yeah.
I've never heard that.
You've never
Yeah.
heard that?
Never heard that.
And I would have to say for the 3 surgeons that I've worked in the past, it's Absolutely true. Like, it's so true. When I worked for the last one before you, she was like this very bubbly, kind, low key, and all her patients were the same thing. Bubbly, low key, and it just meshed well. And then same thing for Dr. Lee, low key. Like, you're super low key, you know that, in terms of your private life. So people who want to do this private personal surgery, do want to do it with someone that also aligns with that.
And even if we showed pretty much like everything for a
Yeah.
patient that wants to be like shown, it's pretty low key as well. Like we managed to do it like on your vibe.
Yeah, even when you do like the stories, you don't always capture their face unless they consented. But even when we take the pre-op and post-op photos, I always tell them I never take your face. At most, we'll see a bit of your chin. But
Yep.
the essential is the area that we worked on. And since he doesn't do face, we never have to get their face. So I think they appreciate that.
I think that being low key, not as a surgeon, I'm saying for patients confidentially, I think that's super important. I agree that it attracts a certain type of patient who, is not trying to be flagrant and flamboyant about what they've done. And I'll tell a little anecdote because I'm also like the anecdotes. But when I was very junior, there was a more senior staff who had operated on someone, and then they ran into that person in public setting, and then another fellow surgeon, so it's like in the same field, would be like, oh, by the way, how do you know that person? I didn't know you know that person. And his answer was super classy, super like gentleman. Like he said something jokingly like, oh, that's my secret, and then just winked, and that's it. Could have easily said, oh, I operated on this patient, I know, but he didn't. And I said, that's how I want to be. And so there's been situations where I run into a patient and someone will ask like, oh, I saw this patient, or even if it's their friend and they said, oh, such a good job on this person. And as like, even if they know, I'll always say as like in a soft kind of tone, like, I can't confirm or deny that
Yeah.
I know that person
I
or
love
I've
that.
operated on the person.
Yeah.
But
Love
they know if they know, and
Yeah,
and if they
absolutely.
don't, and so I think that's super important because it's a personal choice. You don't want
Yeah.
someone to talk about, especially even if I'm talking to another surgeon, I'm not going to tell them about, you don't know what the relationships are. So
Yeah.
Marie-Ève, I'll ask you the first question I asked to Michelle. So you do a few different fields,
Yeah.
right? You do content and you do very good work.
Yeah. Thank you.
But what do you like, or what do you like about doing plastic surgery content, or what do you don't like, and what did you learn like that surprised you when you first came into the OR?
Well, I liked everything, so I don't like anything. But to be honest, I've been in the aesthetic industry for 6 years, so I pretty much it was like more aesthetic clinics. So it's more on the surface type of procedure. And one of my goal as a content creator was to have a surgeon, a plastic surgeon. I've always wanted to see the OR, and I'm very passionate about like how does it work inside of a body. Like I was very interesting about that, and I had one client, and it went like so. I was a little bit discouraged about that type of industry. So when you asked me to do it again, I was like, okay, so I'm gonna start again. I'm gonna try. And to be honest, I really liked your vibe and like how we connect. And I knew what you wanted to have, and that was like totally my vibe as well. So I did it, and I'm so happy that we work together now. And I love everything about surgery. Like the first time I went to the OR, I was so stressed out that I will faint because you don't know how you're gonna react.
Yeah, and you
But
can't control that. If it happens,
I
some
know.
people are just more prone.
I
to
know.
that.
But I realized that with all the drapes and everything, you just don't realize it's a body.
Yeah, that's true.
The only time that I felt a little bit like dizzy, it was something on the eyelid. It's because we saw the face. But other than that, I feel like comfortable, and you always show me and like you explain to me everything, and I'm like I like to learn about all kind of subjects, and I love it. It's for me, it's a dream. Yeah, it is, and I thank you
nice.
for that.
Yeah.
Yeah.
And what don't you like about it, or if there's anything?
The only thing that I would complain is when we do early morning surgery.
Oh yeah, if you're not a morning person, you
I'm
can't do
so
it.
not a morning person, and you're the only one who can wakes me up that early. I'm like, every time it's like, but it's the only thing.
I'm super morning person, so like once I'm up, I'm like talking, I'm like going straight into conversation. I have my like task list going, my to do, and so if you're not a morning person,
I'm
like,
not, no. Like for me, early, it's 7:30.
that's still not bad.
Oh, yeah?
I didn't say
Not
like
bad, yeah.
10.
Okay. But when
Yeah.
I have to go to film the first surgery, I have to wake up sometimes at 5:45.
Yeah, because you have to be there for 8.
Yeah. It depends of where I'm coming from, but like with the traffic and everything, I don't
Yeah.
like, it's super early. That's the only thing. You should just schedule me on the second and third.
Okay, and a follow-up question. So being in the OR,
Yeah.
do you think you have a better understanding of what differentiates surgeons, or
I would say that I
What
understand
you
more
look for.
about the cost.
okay,
When I see all the team, I didn't know like there were so many people in the OR, and it's very impressive. And like everybody has their job to do, and it's amazing to see that. So I think it just made me realize like the cost for the surgery.
what about the surgical procedures itself? Do you see some now that, like, you know, before you went into the OR,
Yeah.
let's say someone thought about, you know, a surgery, let's just say a
Well-
breast surgery, but now that you've seen it, does it deter you from doing it, or be like, step back, or do you think, oh yeah, that's like much better than what I thought it would be,
It's
or is this,
much
you know what I mean?
better because I've always, like I said, I had twins. So for me, my belly is just something for me really important, and I've got to deal with it. And now I decided to make the move after 13 years old and 13 years, and and I thought it was way worse. I thought that you would see like all of the inside and
the
everything, and then
intestines
I
and everything.
noticed that no, you have like
Planes, yeah.
a plane.
Yeah, you have different planes and fascias, yeah.
So I noticed that there was different planes, and it was like pretty much on the surfaces, and I thought it was way deeper, and I was like, oh, okay, so it's not that.
It's not that bad.
It's not that bad.
Yeah.
So I would say that it's the only procedure that I was really happy, and I was convinced to do it. How do you feel about your team today? Was it hard to build the team that you have right now?
Yeah, so I think that's more of like the business side than on running a practice than the surgeon side, for sure. Like, you know, we have a more, I guess we call it like a boutique style practice where we're not trying to do volume, we're trying to do like quality, more
Yeah.
like quality over quantity. And like Michelle is like handles pretty much everything. Like I'll just, you know, Chelsea handles everything too. I mean, everyone handles everything somehow. So I'm
Yeah.
super happy, and I can't do it without my team. That's for sure. I'm super happy with my team. You're part of the team as well. And the same thing is like, you know, when I find someone who's like super solid, I like, you don't have to think about it anymore. And I think
Yeah.
that's like a huge thing. When the goals align, like you said, when you said when you first met me to do the social media, and the like, I forget what the word you used was.
The
but
vibe.
The vibe, like the vibe, the values, the whole like
The vision.
the vision of where you want to go, how you want to work. Like, so it all kind of vibes. I'm super happy with the team. And, you know, we find a lot of the patients will say that. And they'll tell me like, oh, everyone's super nice, like super, and you know, it's very important. But it wasn't easy, you know, for sure you do some
course.
trial and errors, and everyone who I worked with in the past was excellent also, you know, just
Yeah.
nothing negative to say about anyone, but sometimes it just wasn't a perfect fit, you know, it's like, like relationships,
Yeah.
you know, two people are very good, but maybe after a while it's not the perfect fit. Same thing as work colleagues, you know, and I see them as work colleagues. It's not like, you know, I say we work You don't work for me, we work together, right?
Yeah.
You work with me.
And your team is like an extended of yourself.
Yeah.
They
Mhm.
represent you because the patient's going to see more your team than you
Yeah.
at the end of the day.
Yeah. And it's not that they're a representation of me and the values and all that stuff, and we all have the same. But going back to your original question, it was not easy. You know, you do trial and error, you kind of see, and I've had the opportunity to work with a lot of exceptional people throughout the way here. I mean, we're still not at the end, we're like still moving forward, but worked with a lot of exceptional people. Sometimes it wasn't the right fit, and then as you do iterations, you end up finding that perfect fit. And once they find that perfect fit, you just,
Yeah.
you know.
And it's such like a different field for you to be like, you have to be a surgeon, but you have to be like in a business as well with a team, with like employees. And like, this is so many like fields that you have to manage.
Yeah, definitely. The HR aspect is something that's completely new because as a physician, you're just kind of, doing what you're trained to do medically.
Yeah.
And a lot of physicians have no business background, right?
Yeah, I think that's the one thing that was the the thing I noticed about you the most is how business savvy you are. Because a lot of surgeons think that when they have their own private clinic that they know about business. They really don't, no offense. And you can be a great surgeon, but you just might not be
Able to manage people.
yeah,
I mean,
have a business mindset, knowing what's best for your practice and for it to be successful. But Dr. Lee's actually very, very business savvy. I'll give him that. Like, you're really good at that.
Well, I'll say I'm very open to learning,
Yeah.
right? And I'm open to try stuff and change and think there's a lot to learn. And I'm super open to learning, and I think that's what helps, not just in business, I would say, the practice. So,
Yeah.
I think we talked about that a little bit briefly before, but when it comes to surgery, let's say you tell me, oh, Dr. Lee, you're the best at this, okay? I'll still continuously question my ability in that. Like, no, I think I went to a conference about maybe 2 years ago in Spain, and I got back from it, and the company that organized it and sent me there, which I'm very thankful for, and then they asked me, oh, how was it? Because we got a lot of feedback that it was not so great, the content was not so good, the speakers were not that knowledgeable, and I was like, really? I thought it was great. I always will. I think you could learn from anyone, no matter how junior, senior, what they do. There's always something to learn, and if you have that closed mindset, where hopefully in 10 years from now, even I'll still be I'm open to learn stuff. And I think if you're not open to learn, you've just stopped improving, right?
Yeah.
And that's to going back to the business thing. I'm thinking about how I could be better, run the practice better for the patient. Technically, also, I'm always you've seen me in the OR. We're doing the after, and then the nurse is like, "Oh, Dr. Lee, it's very good," and I'm like, do you think I should just tweet? I always have to second guess myself. That in order to keep improving. So that comes to the conclusion of our first trial episode of our podcast. If you have any comments or topics that you'd like us to discuss in future podcast episodes, we would love to hear it. Thank you for watching, and hope you enjoyed it.